Everyone, welcome to Homeopathy Study Group Pro Bono webinar. Good morning, good afternoon, and good evening. So nice to see many of you from different countries and different time zones. Before we start our webinar, always thank you for giving us this great opportunity. And Dr. Sweta Singh, our Chief Administrator, will start the session.
Hello everyone, myself Dr. Shweta Singh, Ka Chief Administrator, welcomes our respected speaker, Chairman and CEO Kavita Ma'am, Ka volunteers and all the attendees to Ka webinar. I would like to take the opportunity to introduce Ka Homeopathy Study Group to all of you. Ka Homeopathy Study Group Pro Bono was organized and founded by homeopath and humanitarian Kavita Kukunur, President and CEO of Kavita Holistic Approach, Ka, on May 5th, 2020. This study group is intended to be an offering from Kavita to the homeopaths around the globe. Sharing, goodwill, and solid clinical work within the classical model are foundational principles for the CA. CA's mission and vision are very unique to inspire young homeopaths, mentor, provide excellency for educational purposes using holistic approaches via webinars, which are based on principles of classical homeopathy, and provide professional continuing educational homeopathic credits for practitioners. We provide merit certificates for spreading the light of homeopathy around the globe. Dr. Kavita is a member of Kevin Friendly Foundation, a non-profit organization that helps to serve poor people in greater needs in India. She is nationally board certified by Council for Homeopathic Certification, CSC, and Achina CPD provider and serve as the associate editor for the Homeopathic Heritage. She is a NASH a mentor for North American Society of Homeopaths and lifetime member of NCH, National Center for Homeopathy. She is the recipient of Martha Ullman Community Service Award by National Center for Homeopathy and Best Entrepreneur Award from Dr. N. Linga Raju, Principal of JSPS Homeopathic Medical College, Hyderabad, India. Tana, Telugu Association of North America, a prestigious organization, honored and awarded her for selfless homeopathic and humanitarian service at Ladies Night Out on October 2022, Michigan. Also, Dr. Kavita received the prestigious Legendary Homeopath Award with joint hands of Honorable Health Minister Dr. Dhan Singh Rawat, Senior MLA Mr. Harbhajan Singh Chima, ex-director Homeopathy Government of Uttarakhand and chairman of Homeocure and Research Institute during National Homeopathic Seminar Homeopathy the Future Medicine at Kashipur on 21st August 2022. We are proud to announce that Dr. Kavita was honored as the Woman of the Year 2023 from prestigious organization NATA, USA. Dr. Kavita was also honored by renowned DTA Executive Committee on Mother's Day at Michigan, USA, with DTA Community Service Award 2023. She also received the Lifetime Achievement Award 2023 by Homeocure and Research Institute Director Dr. Rajneesh Kumar Sharma, Ka Homeopathy Study Group, Kevin Friendly Foundation, in presence of Chief Guest Dr. Shripad Hegde. Best wishes from Homeopathy 360. We are extremely happy and proud that we celebrated 14 years of her book, Beyond the Limits, A Challenge to Prove Oneself, and her second book, A Dose of Spirituality with Kavita, will be completing 3 years. Have completed 3 years, which was launched in presence of Honorable Guest of Speakers, American Institute of Homeopathy, President Dr. Alex Becker, and Council for Homeopathy CSC President Dr. Sheetal Tiwari at our KA webinar. At KA's second annual celebration, our Honorable Guest of Speaker Dr. Jawahar Shah, Chairman of Enlightenment Education, launched its audio version and hard copy. We have donated over $1,500 to 10 to 15 charities within 1 year, which have been listed on the website. As of now, we have nearly 600 recordings on professional webinars related to homeopathy, health-related topics, and inspirational talks available on our YouTube channel with the name Kavita Kukhno. This webinar is moderated by me and it is being recorded as we speak, and we will take questions at the end of the webinar. We will post a jot form in the Zoom webinar chat at the end of the webinar. Please fill the form to receive your certificate, and kindly mute yourself and turn your video off for better connection. Now, let's welcome our honorable speaker and let me introduce her to you all. Today, we have with us Dr. Deepika Balani, homeopathic physician, faculty, national and international speaker, and a researcher. She is the volunteer at KHA Study Group Pro Bono, USA, and recipient of national level awards for research and clinical work and charitable services. She is a joint secretary in the year 2025 and was student coordinator in the year 2024 in Delhi Homeopathic Medical Association. And she'll be speaking on the topic silent pathologies, the homeopathic challenge in subclinical and asymptomatic cases. So we welcome Dr. Deepika to our platform once again. And now, Dr. Deepika, the stage is yours. Please proceed with your session.
Hi, ma'am. Is my screen visible and am I clearly audible? Okay. First of all, I will really thank Dr. Shweta, ma'am. She's very senior to me and she's introduced me with such beautiful words. And also Dr. Kavita, ma'am, for providing me this opportunity to share my views. So before we begin, I would just like to place a disclaimer that all the KHA Homeopathy Study Group webinars are for educational purposes only and not intended to diagnose or treat a disease. Listeners can benefit with the information shared at the webinars. The opinion expressed by the speakers, moderators, and attendees are a part of educational experience and do not necessarily represent the position of Kavita Holistic Approach, KHA, or KHA Homeopathy Study Group Pro Bono. Okay, so there'll be a request that I want this webinar to be very interactive, because only then I feel it would be a little more fruitful. So I hope we all are able to share our experiences today. So silent pathologies in homeopathic practice. I will be presenting on this subject, which is very close to our everyday practice. And these conditions, they progress very quietly without showing overt symptoms, unless they are in a very severe stage, and then they present very dramatically. So the role of homeopathy here should be in perceiving, preventing, and gently managing these conditions. And now this sphere is of growing interest. So in this webinar, let's walk through real cases, clinical evidences, and even materia medica comparisons. And let's evolve our role in this discipline, and let's support these patients who come with these hidden ailments. So this is a broad overview on what we are going to discuss, as in what these silent pathologies are, how homeopathy will help us support these cases, or what are the challenges that we face in real life. Then we'll proceed very systematically through all the cases. We'll compare a few remedies side by side and the diagnostic criteria that we need to follow, and future directions for the case. So, silent pathologies are those diseases which progress very quietly. They do not show clear symptomatology, clear complaints, and they're often discovered only when either complication has set in, or maybe a patient has out of nowhere taken some investigation and some numbers are haywire. The most common presentation, or the most common disease which has such kind of presentation on the top of my mind is always hypertension, wherein there is decades of vascular strain involved, and patient does not even have any pain or discomfort. Also in diabetes, where silently the nerves get damaged, kidneys, eyes, everything goes down the drain, and patient does not feel anything. So these disorders, they pose a very diagnostic and therapeutic challenge in all the system of medicine, including ours. So, why are these important? These are important just because they contribute to a very large share in terms of global morbidity and mortality. Diseases such as cardiovascular deaths, strokes, chronic kidney disease, all these stem from conditions that have remained unnoticed from years. In India also, late detection is common because people do not opt for screening, and they do not like to visit to doctors, and even women in elderly also present late because either they dismiss their complaints, or just they attribute it to some other factor, as in maybe they have not rested well, or they are just aging, so they attribute to non-important factors, and thus their things get complicated. Homeopathic viewpoint in these cases would be, I would really appreciate Dr. Hahnemann, because he was so ahead of his time, and he helped us recognize these diseases uh, by saying them like they are imperceptible deviations in our health. So the strength of our system lies in observing these subtle subjective changes. So many a times what happens is that homeopath is the first physician who hears those vague complaints about sleep, or maybe there is unnoticed fatigue, or maybe patient is craving something. So all these symptoms are suddenly, they come to light and reveal the silent pathology. So we and our case taking especially, we really hold a unique vantage point. One of the biggest dilemmas in practice is whether to, take those vague symptoms or dismiss those, or dismiss those by calling them minor, or to pursue investigation scientifically. This is a very big challenge. So what homeopathy emphasizes is that let's give importance to those individual experiences, and let's be vigilant about those symptoms, because silent pathology, it hides beneath those apparent trivial symptoms, and it's our ethical duty to know whether to probe deeper, or to how to prevent those unavoidable strategies. So how can we use this opportunity? We can use this opportunity by taking cases deeply, and then providing the gentle, profound acting remedies, focusing on early signs and symptoms, timely investigations. We also have therapeutic roles, preventive roles. We have to take up all these roles, and per se, taking a treatment, even homeopathic treatment, is not a replacement for diagnostics, but it is a companion which helps in early detection and providing holistic support to the patient. So let's start with our first system, that is respiratory system. So what happens here is there are many respiratory conditions which progress very silently, and until we reach an advanced stage. A few common examples are COPD, TB, interstitial lung diseases, bronchiectasis, and through symptom and individualized management, we can, with keeping in mind aphorisms 5 to 7, we can help these patients. So what happens in silent tuberculosis is that this is one of the most classical examples, I would like to say. And these patients, they walk into our clinics looking apparently healthy, and maybe they will present with either mild weakness, low-grade fever, or maybe sometimes there are no symptoms at all. And suddenly they think to, have a chest X-ray, and maybe, or some random investigation through which they get discovered, maybe through pre-employment checkups, or no specific cause, they get some investigation done, and the suspicious list comes out. So in this situation, homeopathy can play a very, very crucial role, especially when the stage is early and complementary modalities can be supported with. Okay, so I would now like to discuss my first case, and I would really appreciate if you are able to contribute in terms of remedies, philosophies, aphorisms. Okay, I hope you all are ready. So what happened in the OPD was that there was this 32-year-old school teacher who came with the complaints of acidity, and she was getting a job, and during her pre-employment checkup, she got a chest x-ray done, and there was a apical lesion which was suggestive of old cox. So when we asked her, she said, doctor, I never even had a cough or a chest pain or any other respiratory symptom for that matter, not even other symptoms. She just had a vague weakness, and she attributed to the long working hours she was having. And when we probed her deeply, then we got to know that she used to have sweats in the night and she did not like milk. So, are there any remedy suggestions for this case? Anyone who would like to try? Additional data I would like to give you is that she had a family history of TB, recurrent cold and cough, and restlessness. Anyone would like to suggest any remedy? Anyone? Okay, so let's warm up for the first case. Maybe we'll have some more participation as we progress through. So while we were considering this case, we were like after the whole rapidization case taking and everything, we had three remedies in mind: tuberculinum, phosphorus, and calcarea agar. So we chose tuberculinum because she had a family history of TB, recurrent cold, restlessness. There was a history of recurrent cold cough infections. So in similar cases, if they come in your OPD, so how would you have approached these cases? You'll think of a constitutional remedy first, or you'll prefer intercurrents like what we did? And if at all patient is on ATT, how would you like to integrate the treatment? Any views on this? You can respond in chat also if you are finding it difficult to unmute. Okay. Proceeding ahead, I would now like to show you the next case wherein we dealt this kind of similar pathology. There was a 62-year-old retired teacher who came to our OPD, and her complaints were mild breathlessness only on climbing stairs. And I'm sorry, the patient was he. So, patient dismissed his complaints by saying, "Doctor, I'm getting too old. Maybe it's just weakness because of that I'm facing." And he was a long-term smoker. He used to take at least 20 cigarettes per day for 30 years. But then he claimed that he quit those cigarettes for about 5 years ago. There was no cough, no chest pain, and when we auscultated that patient, the patient came up with minimal wheezing. We also got the spirometry done, and it showed early obstructive patterns, that is FEV1, FEC was less than 70%. So the patient said that, I'm feeling fine, doctor. I don't think there's anything serious with me. So here also the symptoms were very scanty, and there was silent progression happening through years, and the patient presented here with substantial damage. Constitutionally, we could find that he was a little bit anxious. He had sensitivity sensitivity towards cold, and he was obstinate by nature, and he also came up with digestive complaints. Any remedies here? Do you think we'll be able to approach cases through homeopathy with such scanty symptoms? If this patient came to your OPD, what would you have done? I hope I'm clearly audible and visible and my questions are reaching you. Okay, so what we did in this case was that the top 3-4 remedies that came to our mind after the whole process was lycopodium, sulfur, and naxomica. Our remedy that we chose was lycopodium because he had digestive issues with evening aggravation and the complaints were right-sided. And the patient within 4 weeks improved in his energy levels and the breathlessness were also reduced. The spirometry, when repeated, was stable, and then he was prescribed and suggested to go for breathing exercise and dietary modifications. So, have you seen any such COPD or pulmonary TB cases wherein patient only report with vague complaints like I had, or maybe we are relying too much on repeated or recurrent disturbing cough that comes with TB? So also I would really like you all to think whether spirometry, chest x-ray, the prescription frequency of such investigation should be more frequent, especially by us homeopaths, and especially when patient presents with unexplained weaknesses. Do give it a thought. Okay, so now progressing to the next symptom, cardiovascular system. Here lies one of the most notorious of the culprits, hypertension. I often term it as silent killer. So what happens here is that patient, walk around with such dangerously high blood pressure, even for years at a stretch, and without showing the slightest of the symptoms until one day they'll suddenly present with stroke, or maybe they present with renal failure, myocardial infarction, anything they can be presenting with. So what happens here, one more deadly entity I would like to mention is this silent MI. Uh, what happens is that these patients, they never experience any chest pain, and then suddenly on one ECG there is a scar of the infarct that they must have had some time ago, or maybe during arrhythmias where atrial fibrillation was maybe accidentally discovered. And such cases, they have a huge risk of embolic stroke. Our task here as physicians should be guiding these patients, or maybe through our public health service, to intervene holistically and guide them through lifestyle care, preventive measures, and even individualized medicines where, as and when required. Okay, so my most favorite, most notorious complaint, silent hypertension, no symptoms at all. So these patients, they are, as reiterating from earlier, they used to come in routine checkups, no complication either with stroke, angina. And then here through homeopathy, our challenge would be, not just to lower those numbers, but to address the whole constitution and benefit the whole patient. Even use organ remedies where, as and when the support is of them is needed. Please feel free to suggest remedies or any thoughts that you might have while we are discussing the presentation of cases. especially for the new joinees, I'm saying. Okay. So in this case, what happened was that there was this patient with the age of 58 years. He was a banker. So this patient came to me with the symptom that he's having some difficulty in sleeping and is facing insomnia. So I was routinely recording his BP and I found his blood pressure was 170 by 100. And he said, doctor, by laughing, he just said that, doctor, I feel perfectly fine. There is no headache, no dizziness. See, I'm so active. I'm just running here and there. I'm perfectly fine. His personality, through his personality, he was a very high ambitious person, zealous person, perfectionism through the roof, and irritability when he was interrupted. Even during case taking, he showed those signs. And he was highly dependent on stimulants such as coffee. I think this case is clear in terms of remedies, so let's proceed to the remedy directly. We gave him Nux vomica 200, that was given him weekly, and then his lifestyle modifications were also taken care of. Over the period of 8 months, his BP stabilized to 130/85, and then he was even calmer in temperament. I hope we have gone through those lectures given by Kent, wherein he says that if you are lucky enough, your remedy hits correctly, and then you even get those changes in the temperament. So such kind of cases, they give you so much of boost. Okay. So my main supporting crutch in this case was also cratagus. So mother tincture as and when required. So have you ever used those organ remedies in such cases, or maybe you want to give them alone, or like a additional remedy, or maybe like what I did, or maybe also I have this question wherein such people who are so ambitious and they really overlook their symptoms, do you think that these patients are at a greater vascular risk? Please give it a thought. These are very important questions that you might face in your practice. Another treacherous disease, silent MI. Here, patients, they never even complain of chest pain. Sometimes they may complain of or tiredness or breathlessness or on exertion. And this complaint wherein they don't show their symptoms, it is commonly seen in diabetics where the neuropathy has occurred, and autonomic neuropathy especially. And these patients, they do not feel any pain, any symptom, and they are suffering so much from inside. So there was this female of 60 years who came to the clinic, and she just had occasional heartburn, mild fatigue. So she said, doctor, I just have some acidity. Could you help me? We got her ECG done because there was fatigue. So we wanted to explore a little more in her case. In ECG, there was an evidence of old anterior wall infarction. She said that she never faced any chest pain. Also, during her analysis, when we were taking her case, she revealed fear of heart diseases. She used to have some palpitations, which used to worsen at night. And there was this feeling, as if God knows what will happen. And this kind of impending doom that will happen to her, she used to have that sense. So any remedies, anyone? Additionally, I was very reluctant to only keep her on homeopathy in this case because she has had such a big scar in her ECG. With the help of the cardiologist, over time we were able to help her to sleep better, reduce her anxiety with the remedy also that we gave, and her energy levels were also better. the damage that has happened, we cannot undo that damage, right? But at least we can strengthen these patients holistically. As it's a very famous dictum in our books that once there is a damage, pathological damage, substantial damage that cannot be reversed, you can only help them with the current status they are, and you can better the quality of life of such patients. So according to repertorial analysis, we gave her arsenic album. You could also think of, depending upon the indications, you could again go for cratagus if you want to strengthen the heart, or maybe the patient comes in the climacteric age with such complaints, then you could think of lachesis if there is hot flushes, climacteric aged women, left-sided complaints, heart is involved. If the patient is anxious, you could think of anxious remedies like I did in this case, arsenic album we gave, or maybe you could go for some organ remedies. If there are any more organ remedy suggestions, please feel free to add it to the chat. Next disease, silent atrial fibrillation. This is also often discovered on ECG, and the stroke also risk increases in such cases, and the symptoms are very vague. Coming to my next case, here what happened was there was a 72-year-old retired teacher who just came for general checkup, and there was occasional fluttering in the chest, but it got ignored. ECG revealed atrial fibrillation with controlled rhythm rate, and there was no complaints of chest pain, no breathlessness, but with this kind of finding in the ECG, his stroke risk was very high. My top 3 remedies for this case was digitalis when the complaints were slow, irregular pulse, faintness, or there is anxiety about the heart. Lycopodium, especially when there are additionally concomitant, you have digestive symptoms, and maybe aconite you can give as an acute stage remedy wherein there are sudden onset palpitations or maybe anxiety, restlessness the patient comes with. Also, additionally, a tip I would like to give here that during the routine checkups, the routine follow-ups, please check for pulse of the patient carefully. Put your hand on their pulses for at least 1 minute. Apart from the rate, just check the rhythm, and every aspect of the pulse should be checked, because the stethoscope fingers, they are best diagnostic tools even when you do not have access to immediate ECG, or these are those basic tools which can help you catch something which you do not routinely see in such silent cases. Next case, congestive heart failure. Vague symptoms such as fatigue, swelling in the foot, and nocturia maybe the patient can present with. There were no chest pain symptoms, and if missed, the patient mortality, the patient death rates are high. So there was a 65-year-old male who came to our clinic saying, "Doctor, I'm feeling very tired these days, and my shoes tighten up in the evening." So on examination, we found pitting edema on his ankles. There were basal crepes mild, and there was no suspect of heart disease on the plane of the patient. Then we got his ECG echo done, wherein echo revealed the reduced ejection fraction. So here our remedy was arsenic album, because patient was restless because of this kind of swellings and tiredness that he was having, and his symptoms were worse at night. Other remedies that you could think of is like strophanthus. Strophanthus is good for dropsy with slow pulse and failing ability to compensate by the heart. Again, you can go for organ remedies here. Silent peripheral artery diseases. This is also very easy to miss. unnoticed till there is ulceration, gangrene they have set up. Most common risk factors for these patients are diabetes, smoking, and hypertension because they damage the vessels directly. And the symptoms may present as claudication, cold feet, non-healing wounds, delayed healing of wounds even. In this case, what happened was there was a 60-year-old patient who was a smoker, and there was this very tiny wound on his toe which was not healing. He even denied that there is any pain. On examination, we could find his feet were cold, his dorsalis pedis pulse was absent, and the diagnosis came out as peripheral artery disease. So, how do you think you'll proceed about this case? A few remedies I could suggest here is CKL core, maybe wherein you can have these gangrenous tendencies, coldness or bluishness of the extremities you can have, painlessness in the ulcers you can have, which was the case in this patient. And for maybe you can think of arsenic album, the pain is burning and the patient is anxious in nature. Or maybe you can think of carbo-veg also, wherein there is a stasis in the venous circulation and the patient has a tendency to collapse. So please think on these points wherein every patient, especially under 40, should they be undergoing BP checkup, ECG checkup very frequently? And if us as homeopath have any role in preventing such cardiology symptoms, or maybe we should focus more on numbers or on the patients. Or maybe you can think it in this way that if suddenly a patient comes to your clinic with such high BP, maybe 170, 100, 200 BP he's coming to you with, or a patient who are irritable and then they are craving coffee like I had in one case. So how would you take up their totality with such scanty symptoms? How will you balance the homeopathic philosophy along with philosophy of individualization with the preventive aspects of medicine? How will you bring everything on the same plane? Please feel free to share views anytime you would like. Next system we are proceeding for is GI. Another most common, peptic ulcers. These are surprisingly common, and these patients come with ulcers and no pain. Can you believe ulcers with no pain? And the first presentation is sudden bleeding in the gastrointestinal tract. So if we are able to discover these cases and identify these predispositions in the early state, maybe we could spread awareness about such states, especially for those people who are living in high stress environments wherein they are not eating properly on time, and especially with certain constitutional types wherein the patient is of anxious nature, or maybe he or she's of a very irritable nature. So how will you take these cases? So this 40-year-old female, she was an executive. She came to me with the complaint of tiredness, and when we questioned her further, she admitted black stools. There was no abdominal pain. We immediately told her to get the endoscopy done, and in her history also we found that she had a prolonged work stress. She was craving spicy foods. She used to wake up at 3 a.m. with especially those anxious, restless thoughts. My prescription here was arsenic album 200, and within 3 months her energy levels improved, stools had normalized. We even repeated her endoscopy after 6 months, which showed that the mucosa was healed. Other remedies that you can think of this case is nux vomica, where the patient is very stressed about their business and craving stimulants, irritable, constipation history, or maybe phosphorus, where they are craving those icy foods and then they tend to vomit after consuming cold water, or maybe hemorrhagic tendencies there. The patient is very sympathetic in nature. So how do you think you will progress in this case, wherein you have to decide that if to prescribe the patient constitutionally or local remedies are required in that stage in time? What would you have given in this case? Would you have given arsenic, naxomic, or maybe some other remedy? Please feel free to share with me. Next, we go to liver. Most common non-alcoholic fatty liver disease, hepatitis, cirrhosis, hepatocellular carcinoma. They remain asymptomatic again till the stage is very advanced, and these are suddenly detected on ultrasounds or maybe weird LFT levels. They get some random health checkup done and they come up with this vague symptoms, dullness in the abdomen, or maybe acidity, stool issues, or how to pick up those pointers on a quicker time and case. Okay, so in this case, what happened was there was this 45-year-old businessman who casually walked in the clinic, says, Doctor, I just have some mild acidity after dinner, and I don't think there's any serious, just give me some acidity medication. So we pushed him for detailed case history, wherein he revealed that he was fond of sweets. He used to crave warm food, habit of late dinners, and his abdomen was bloated by evening. He used to pass small quantities of stool with difficulty. We also examined his abdomen, wherein there was tenderness in the right hypochondrium. And when we got his ultrasound done, it was grade 2 fatty liver, and he was completely asymptomatic otherwise. And seeing his reports, he's like, Doctor, I did not feel anything. And then he was laughing it off. So we gave him lycopodium 200 on the basis of the above mentioned symptoms. And he was also irritable when he was contradicted. And we followed him up for 3 months, whereas his SGPT got normal, bloating got improved, ultrasound repeated in 6 months, wherein the grade of the fatty liver got reduced. So this is very important to pick up these silent liver pathologies. You could also think of again maybe nux vomica, chelidonium. All these indications are known to us. Another case that came to me was with ankle swelling, tiredness, 55-year-old school teacher. She had no abdominal complaints, no jaundice, and there was this mild pedal edema she came with. Ultrasound liver revealed nodular liver, and with mild ascites was there, and her cirrhosis was compensated. The patient was very philosophical by nature. The appearance was very untidy. Burning pains were there in soles. Patient had not so much preference for hot weather. He used to throw off his covers over the feet in the night. Here we started the case on LM potency, sulfur, and even we use we started with centesimal potency first, and then we shifted to LM. And then over 6 months, we could find reduced swelling and improvement in the general health, and his ascites did not progress. If there is hemorrhage, you could also think of phosphorus, or maybe if you want to go for organ specific, you could think of cardus marianus. If there are any venous stasis, you could note along in such cases. Please do give it a thought that how many fatty liver cases only present with just random bloating, acidity, or maybe what subtle hints help you to order these liver function tests. Or if you find a case, there is a fatty liver disease and maybe cirrhosis is there. So what are your favorite remedies, or how do you prescribe remedies? The next system is renal. So why these cases remain hidden? These patients, they may completely be well, and suddenly their EGFR will decline, or maybe their microalbumin would come up, and then we usually don't see edema or maybe those uremia symptoms until the disease is very advanced. So these soft clues we have to be very, very particular about. That is nocturia or maybe ankle swelling, swelling on the face, or long-standing hypertension. And then we can order simple screening tests, or we could also think of albumin-creatinine ratio, blood pressure, basic urinalysis, especially those cases wherein the patients are very, very high risk, such as they present with ultrasound, hypertension. So all these can literally change the trajectories of the case. So this case, just some swelling. Again, 53-year-old patient, type 2 diabetes, just fine having ankle puffiness. BP was 152/94, UACR was 110 mg per gram, EGFR was 72 ml per minute, and there was no dysuria, no flank pain, normal USG, A1C was deranged. Mental picture was like maybe the patient was a little driven, oversensitive, irritable, and was dependent on coffee. The case was diagnosed as early diabetic kidney disease, and the remedy given in this case was Nux vomica, that was constitutional. So this patient used to come and say, "Doctor, my sugar is just under control. I just have some mild swelling. Just give me some medicine." And this case was a software team lead, very confident and impatient. He used to sip on cups of coffee again and again. So such type A personalities, they really work well with remedies like Nux vomica. Other remedies that you could have thought of in this case maybe would have been lycopodium, wherein the patient has some kind of anxiety, flatulence, tendency towards right side, or maybe evening aggravation around 4 p.m. And then you could also think of some sulfur, maybe if the patient is having burning, or he's having some messy habits, or the case is too less on symptoms and you want some intercurrent remedy or some no sode or anything you could need to open up such cases. Next case, doctor, I'm perfectly fine. Again, 61-year-old male, long-standing hypertension, creatinine was increased 1.5 mg per dl, ACR deranged, GFR deranged, no urinary complaints, mild forgetfulness, and he was also chilly and had those dependent kind of traits, wherein for every small thing he used to seek support. This case was diagnosed as hypertensive nephrosclerosis, and the remedy given was Brita carb, because the patient was elderly and had some vascular degeneration. Other remedies that could work in such nephrosclerosis cases could be maybe aurum metallicum, wherein there is arterial sclerosis in the patient, and those peculiar mental symptoms of depression you see with aurum metallicum come in your case. Or maybe you could, as an adjunct, support them with organ remedies. So next case, burning only at the end, in the end of the urination. Thin stream urine, 35-year-old female, normal USG, crystals were there on urinalysis. Even least urine she used to pass, she used to have those symptoms. She had to strain. She was better by standing. And the urine was also scanty. Mentally, she was an anxious kind of a person, especially about the pain she was suffering, and she used to cry easily and sensitive. The remedy that was chosen in her case was sarsaparilla, because there was an end stream burning and especially difficulty during those last drops. And her ultrasound was also normal, I must tell you. Though she had no problems in passing urine, but she used to dread those last few drops that used to pass. This was a keynote textbook sarsaparilla. We gave her in 200C with fluids. Citrate was also given to her, and she was told to follow. 2 months later, she had no fear of urinating, and repeated tests showed reduced crystalluria. Other remedies that you could have thought of in this case, if the thing maybe through the sidedness of the complaints, you could have chosen berberis, lycopodium. Sandy urine, you could have taken lycopodium. Stitching pain, especially to thighs, hips, you could have taken berberis. Bubbling sensation in the kidney, if the patient presents with such peculiar symptoms, you can again think of berberis. Now, this 28-year-old case wherein there was occasional urine, and then he used to complain that my urine used to look like Coca-Cola occasionally. This is a cola-based drink. So they used to say that there was this peculiar color occasionally in the urine. Between those episodes, he was normal, but he had again urine ACR deranged by 180, EGFR 95. There were dysmorphic RBCs in urinalysis. Mentally, he was sensitive, sympathetic, easily scared. He had thirst for cold drinks. With this hemorrhagic tendency, sensitiveness, thirsty patient, we chose phosphorus. And his recurrent infections were then taken care of by 6 months. Other remedies you could have thought of in this case were terebinth, wherein you could have had symptoms such as smoky colored urine, maybe albuminuria is there. There is tenesmus in the bladder, along with the hemorrhagic tendencies. One more remedy you can think of is mercor, Mercurius corrosivus, wherein if there is tenesmus like that in dysentery with severe cystitis and irritation in the glomerulus. Again, this case, early CKD with the interstitial involvement, wherein 48-year-old female, chronic NSAIDs overuse, and the urine was scanty, pedal edema in the evening. Urinalysis was bland, and ACR was around 55, EGFR 64, PP 146 by 92. The sensation she complained of is, she said that she had burning, stinging kind of edema is there, and there was thirstlessness, worse by warmth. Again, stinging edema, classic APIS case. Okay, so we used to monitor her BP. We used to tell her to stop taking NSAIDs, hydrate herself well, monitor her BP, and even we used to monitor her renal indices. Other remedies you could have thought of is arsenic and epocinum. Epocinum you could have taken for gastric sinking. Ma'am, I hope we have a little more time, just a few more slides left. Thank
Yes, you can continue.
Thank you. So please give it a thought, as in how would you tackle these high-risk patients wherein there is diabetes, hypertension with deranged modalities in your clinic, or maybe what keynote symptoms you are able to find, especially in cases of stones, or maybe some more organ remedies such as solidago, eel serum, serum manganellate, terebinth. Would you have used these in cases of CKD? How would you prescribe in these cases? What holds you back? So there are a few tips I would like you to take home along with you, wherein please be aware of those red flag symptoms just by taking up the simple tests. And please individualize your cases well, observe the modalities, document those changes, and monitoring will give you the voice that you need to hear in such silent cases. Okay, so a few more cases we'll go through. 46-year-old government clerk, overweight, and he presented to OPD with burning feet at night. So we asked him, what's the most troublesome symptom you're having? So he said that he feels as if his feet are on fire, especially when he lies down. And he attributed this symptom to long sitting hours in the office. His BMI 29, he had central obesity, no edema, peripheral pulses were good. His fasting blood glucose was deranged 152, HbA1c 7.1%. I just have these numbers in cases there were no specific symptoms. His urine also had glucosuria, there was no protein, and he had borderline increase in the triglycerides. His complaints revealed silent type 2 diabetes, wherein the neuropathy had already set in, and we gave sulfur to him in this case. Other remedies you can think of: cesium, phosphoric acid. You can also think of these cases, and patient can be managed long term with lifestyle techniques and remedies. Hypothyroidism, again, no symptoms, TSH 8.4, TPO antibodies positive. Patient was coming with Hashimoto's to us, and she was a typical calcarea card picture wherein there was weight gain. She was chilly, profuse perspiration on the head, and constipation. She's still in follow-up after 2 months. Her TSH was reduced to 5.2. Other remedies we could have taken up in this case are sepia and graphitis, maybe. Similarly, I will now take up a few red flags that come up in the cases. This was a 50-year-old executive, no symptom, he just had a paunch. And we took his cholesterol investigations, they were deranged. Silent dyslipidemia, typical case, nux vomica with the characteristic modalities, because he was sedentary, he was on rich foods, stimulants, sedentary lifestyle, irritable kind of a patient. Other remedies you can think of is lycopodium, sulfur, especially when sulfur you can think of if there is a metabolic syndrome, the obesity is there. Patient is aggravated by heat. This patient is still in follow-up. 3 months later, his LDL is down to 160 now. We started from LDL 182, it's now up to 160. Another case that you could think of, neurology, silent Parkinson's. Slight disturbance in sleep, maybe slight motor complaints, nothing specific. And then there was this 62-year-old male who came to us with chronic constipation and vivid dreams. That's it. No motor signs, and his family had pushed him into the clinic just because he was having some changes in the facial expression and his voice was getting softer. His diagnosis was confirmed by SPECT scan, and the remedy you could think of in such cases is aurum, causticum, and plumbum. Aurum if the patient is heading towards depression. Causticum maybe when there is stiffness in the body or incomplete evacuation of stool is there, like was there in this case. Plumbum metallicum you can think of if there is retraction in the abdomen and paralytic kind of symptoms in the GIT. And you know what, we miss these cases, especially when the motor symptoms have not set in. You could also refer to a detailed Parkinson video webinar that was conducted on KHA itself 1 year ago by myself only. You can refer how Parkinson was progressing. Then strokes also, they present very silently. In this case, what happened was this patient, we rushed him to MRI. We rushed her to MRI rather for dizziness, wherein we saw multiple lacunar infarcts. There was no history of stroke. She was just having mild imbalance and forgetfulness. So these silent strokes, they behave like a time bomb. So they, accumulate in the brain with such a small injury sometimes. So you can always give them neurovascular support and through strengthening their constitution. This case, we gave Baraita carb because of her memory decline. Oh, that was associated, and she was showing some signs of timidity as well. If the element of paralysis sets in, you can think of plumbum also. Or if the complaints are of left-sided, maybe climacteric post-menopausal woman, or maybe speech difficulties there because speech is located in the left side of the brain. So all these kind of symptoms, then you can think of lachesis also. Silent dementia, slight forgetfulness, appointment we forgot, or maybe just we forgot where we kept those keys, or maybe they're unable to find words about what they want to speak. So in this 68-year-old male university professor, okay, family was noticing that he was repeating a few questions and he was losing the train of thoughts during the lecture. His mini mental state revealed a score of 2630, and then MRI also we got done. It showed atrophy in the hippocampal region. As this patient was having loss of confidence also, little bit with weak memory, and then he used to say those few things that maybe I should listen to one thought or maybe I should listen to the other thought. So we gave anacardium oriental in this case, and other remedies that you could also think of in such cases is like alumina, wherein the patient maybe has confusion about their identity or speech mistakes are there, or maybe Baraita carb if the patient is very childish. PCOS I'm going to skip because random investigation when you get LHFSH deranged, you can think of great remedies like pulsatilla, thuja, or maybe sepia. This is an important case. Infertility, 3 years married, and she was having sudden discovery of endometriosis on laparoscopy. There was only irregular spotting, that's it. So we gave her lachesis because she was having some intolerance of tight clothing around her abdomen. This was the only indication we had with her. Also, this endometriosis was more on the left side. Other one good remedy you could think of in such cases is xanthoxylum, wherein when the patient presents with neuralgia in the pelvic region, and especially she has a very intense dysmenorrhea. Other thing, maybe MacPhos you can think of in dysmenorrhea. Okay, this is also an interesting case. There was a silent cervical dysplasia. Most common cause is HPV infections. Routine pap smear, the patient was very aware about her health. She conducted a routine pap smear wherein there was a low-grade intraepithelial lesion. She had no symptoms whatsoever. Her cycles were normal. So you could think of remedies like thuja, causticum, carcinosin. This patient was carcinosin because she also had family history of cancer, and she was very particular about her work. As also you can note that she was very particular about her health, and she was getting these tests done so that this low grade symptoms were discovered early in this case. Pediatric cases, malnutrition, suddenly there is just loss of weight, child is not concentrating well, or maybe he is stunting or having frequent infections. So this 8-year child came to us, just poor school performance. We got the blood work done. There was low zinc and vitamin A deficiency in the case. We supplemented the child with the required minerals and vitamins along with constitutional remedies. This case was China because there was just nutrient loss in this case and nothing specific. If there is weaker assimilation wherein the patient is unable to pick up the right amount of nutrients from food, you can think of Cilicia or maybe Calcarea phos if even the dentition is disturbed. Anemia also, similar approach. You could think of, there was this 12-year-old girl, just frequent headaches, typical case of calcarea phos she was, and she was having anemia with poor appetite. Other remedies you could think of in this case are natrum mur, wherein there is maybe sun headache, salt cravings, or ferrum phos, where the false plethora patient presents with. Silent vitamin D deficiencies, please supplement the right amount of vitamins and minerals in such cases, then followed by constitutional remedies. Just 2 or 3 more cases we'll proceed with. There was this case of geriatric case, silent osteoporosis, wherein the fractures are maybe the first signs, or maybe sudden DEXA patient got done. So this patient, 74 years old, female, wrist fracture after just a minor fall. There was no prior history of any other back pain or any other thing, or maybe any other complaints, and was diagnosed osteoporosis on the basis of DEXA T score, which was 3.2. So weak bones or maybe delayed union of fractures, you could think of calcarea calf, delayed union, you can think of silicea, or if the patient is very tall, thin, fragile, you could think of phosphorus. Sarcopenia, very interesting case. 78-year-old male who came with knee complaints, and his gait speed was less, his grip test was weak, and even in spite of his adequate weight, he was diagnosed with sarcopenia. Good remedies you can think of: calcarea fos, ruta, arnica. When there is debility, you could think of arnica, soreness, weakness in tendons, ruta, weak muscles, calcarea fos. Sensory decline, the patient, 82-year-old, not interested in family gatherings. Only this was the symptom. When we inquired from the patient, he was not interested in family gatherings because he was having some difficulty in hearing. And when the audiometry was done, the patient revealed severe presbycusis. So here the patient was given phosphorus because there was slight humming also in the ear, and the nerves got weak in this case. Maybe you could think of sulfur if there are vision symptoms involved, or maybe conium when there are dizziness or maybe weakness proceeds. Very interesting oncology. Silent breast cancer, 52-year-old female, routine mammogram revealed DCIS, no lump, no pain. You could think of remedies like, depending upon how the lump feels to you, maybe you could give conium for the hard lumps, or maybe family histories there, you could think of carcinosin. You could also think of indurated nodes, you could think of phytolacca. Silent colon cancer. This case presents especially in right-sided affinities. For example, in this case, a 60-year-old male with fatigue and pallor, colonoscopy revealed he had right-sided adenoma. Remedies we thought of: carcinosin, nitric acid, and phosphorus, depending upon the hemorrhagic tendencies or maybe fissure tendencies, cancer-prone constitutions, respectively. Last case for the day, cervical cancer, asymptomatic until late stages. One case we discovered just by doing a routine PV examination, and there was bleeding that we couldn't stop. We had to refer the case immediately, get her bleeding controlled. Then all her investigations were done. The pap smear showed high-grade lesion. Then the patient also wanted to take up homeopathic remedies. So as her HPV test was also positive, we gave her thuja. Other remedies you could have thought of in such cases was causticum maybe, or for ulceration tendencies. Please think on all these points. These are very, very important. You have to reconcile objective symptoms, subclinical findings, especially with the symptom totality that you get. Be very aware about how and when you are prescribing laboratory diagnostic tests, whether they should be minimal or they should be proactive. Should we prioritize miasmatic approach or organic approach when the pathology is presenting to us? You could also complement homeopathy in many cases along with modern medicine and keep the patient stable and safe. And maybe you could also, when there is almost to no symptoms, whether you have to wait and watch, you have to prescribe, you have to investigate, please be aware of these points. It's our ethical responsibility till where we have to intervene, in the silent cases we have to intervene, or maybe in the overt diseases we have to intervene, or how much we have to intervene. Clinical takeaways: please be aware of silent pathologies. They are a challenge as well as opportunity for us. Remedies can be applied, especially before gross pathology comes. Please be aware of miasms, constitutional pictures, organ support. Keep a good balance of these remedies so that the patient remains stable and is getting the right kind of intervention from us. Please do not ignore modern diagnostic techniques, rules, and the laws of your country, especially when you are dealing with such cases. And please be safe yourself also. Keep the patient safe. Be very ethical in such cases. Keep the evidence ready and intervene early. Lastly, in silent diseases, the voice of vital force is very, very faint. Listen to it deeply, and homeopathy will allow you to hear it before the patient is drowned into pathology. I really thank you all for your presence and commitment to advancing homeopathy, listening to me for so long, so patiently. Are there any doubts, anyone? Anything you all want to say, you want to discuss? Okay, I'm really happy I have some remedies in cases: Sepia calcarea phosphorus, Anacardium plumbum sepia. Thank you, Dr. Brenner, for your active participation. I really appreciate it. Thank you for the compliments.
Thank you, Dr. Deepika. It was really, really wonderful and very nice presentation. And now we would like to take the privilege to honor our speaker with KA Appreciation Certificate, and please accept it from KA Homeopathy Study Group. Thank you for your gracious presence and for your precious time in sharing your knowledge and wisdom.
Thank you.
Okay. Many congratulations.
Thank you. Thank you, Dr. Bliss. I'm leaving my phone number and email ID just in case anyone faces any doubts. Please feel free to contact me. Because I've taken so much time in the webinar, I would really appreciate you to reach out to me on emails or maybe through WhatsApp, and then maybe I can solve your queries more.
Thank you, Dr. Deepika. And let me announce the upcoming October event that is on October 25th, 2025. And we will be having Dr. Jonathan Hardy. He will be speaking on homeopathic healing with the imponderable remedies. And you can find the link to register at our website, kavitakehomeo.com. Don't miss the webinar. And now I would like to thank Dr. Deepika for such a enlightening session, and heartful thanks to our viewers and followers to join us today. We have many such informative webinars lined up in the upcoming sessions with many more renowned homeopaths. And for the upcoming webinar info or any other updates, follow our social media handles at Instagram, LinkedIn, Twitter, and Facebook. If you missed any of the webinar, you can watch it out at our YouTube channel with the name Kavita Kukunur. And I'm really thankful to our CAR volunteers for their continuous support and selfless services with which we are able to organize these webinars in a successful manner. For any other info, reach us at carstudygroup@gmail.com, and don't forget to fill the short form to receive your participation certificate. Also, I would like to uh, read the ethics and benefits. To be a CAR volunteer or speaker, it needs at least 1 to 2 months active volunteering. Only CAR speakers' themes are promoted in newsletters and webinars. CAR provide volunteering for 2 to 12 months, respects and inspires volunteers to grow. Active volunteers will be promoted through our website, social media, and added to WhatsApp group. Articles of volunteers will be posted on KA website and newsletter and will be sent for publication at other journals too. Volunteers and speakers are eligible for prestigious KA annual awards. Volunteers are eligible for KA inspirational talks. Volunteers are eligible for case discussions. KA promotes homeopathic organizations as well as their mega events. KA promotes great work of speakers through their book reviews. Honorable guests may propose their future courses or events after the webinar. KA maintains a healthy and happy environment, so keeps only like-minded folks. KA requests everyone to maintain the confidentiality of the group. So thank you all of you for joining us today. And let me just, shall we wind up? Thank you once again to all of you.